Hello everyone, I am Salwa, Assistant Professor in the Department of Medical Laboratory Technology at Yenepoya School of Allied Health Sciences. These are the specific learning objectives. At the end of this session, the students should be able to define microbes and its related terms, explain infection and its types, list different sources of infection, and elaborate on modes of spread of infection. Microbes. Microbes are extremely small living organisms, and based on the relationship with their host, they can be divided into three types. They are saprophytes, parasites, and commensals. Saprophytes are free-living organisms which live on dead or decaying organic matter, and usually they are unable to invade the living body, but under conditions, certain conditions, maybe when the host resistance is lowered, some bacteria, maybe like Bacillus subtilis, they can invade and cause an infection. They can cause pneumonia, septicemia, and endocarditis. Parasite. Parasite is an organism which lives on living hosts and derives nutrition from the host without any benefit to the host. They are mainly divided into two types: macroparasites and microparasites. Microparasites include bacteria, fungi, and viruses, whereas the macroparasites include the helminths. Commensals. They live in complete harmony with the host and they do not cause any harm to the host. They constitute the normal flora of the body, for example, Staphylococcus epidermidis of the skin and Escherichia coli of the gastrointestinal tract. So apart from these three terms, there are other terms which we should know. The first one is the pathogen. A pathogen is a microorganism which is capable of producing a disease. For example, tubercle bacilli, which is a causative organism for tuberculosis, typhoid bacilli, which is responsible for typhoid. Opportunistic pathogen. So there are commensals or saprophytes. They produce disease only when the host resistance is lowered, and that may be during injury or any underlying infectious disorder like AIDS. Pathogenicity, it is the potential ability of the microorganism to produce a disease, and virulence is the disease producing power of the pathogen. So moving to the main topic, that is the infection. So infection is a process which refers to where the microorganism enters the body, establishes itself, multiplies and invades the normal anatomical barrier of the body, resulting in disease. But all infections do not invariably result in disease. Types of infections: primary infection, secondary infection, reinfection, cross-infection, nosocomial infection, iatrogenic infection, endogenous and exogenous infection, atypical and super infection. Primary infection, this refers to the type of infection when a person gets it for the first time by a pathogen. For example, a person gets urinary tract infection by Escherichia coli. Reinfection, when the host gets the same infection for the same when the host gets the same infection for the second time by the same pathogen. That is, a person has got urinary tract infection by E. coli, has been cured, and then again gets urinary tract infection by E. coli. Secondary infection, a person is already having a primary infection, his resistance is lowered, and that time he can get a secondary infection. Cross-infection, a person is already suffering from a disease, he gets infected from another host. And these cross-infections which occur in the hospitals, they are called as hospital-acquired infection or nosocomial infections. As you can see in the picture, the infections can be transmitted from the visitor to the doctor or the healthcare worker, from the healthcare worker to the patient, patients to patients, and from the patient to the hospital environment. And then the cycle continues. Iatrogenic infection, it is a physician-induced infection. When the healthcare worker does not follow proper hygienic or hand hygiene, the bacteria from the previous patient can be transmitted to the next patient during therapy, surgery, or investigation. Endogenous infection, the source of infection is the host's own body. That is the normal flora of the body. For example, Escherichia coli is the normal flora of the gastrointestinal tract. But if it gains entry to the urinary tract, it can cause urinary tract infection. Exogenous infection, the source of infection is an external one, that is outside the host body. Latent infection, here the microorganisms, they remain latent or inactivated in the host tissue following an infection, and they produced symptoms only when the host resistance is lower. They get reactivated maybe in case of physical or emotional stress, or when they are exposed to UV light. For example, herpes simplex virus, which undergoes latency in the nerve cells. Atypical infection, here the clinical symptoms are completely absent. Superinfection, in this type of infection, a person is already having a primary infection by one type of microorganism, and he gets a secondary infection by another type of microorganism, but that microorganism is resistant to the treatment which is used against the first microorganism or the first infection. Moving to the sources and reservoir of infection. So here a source refers to a person, animal or object from which the microorganism is transmitted to the host. Reservoir is the habitat in which the organism will live and multiply. So in some cases the source and reservoir are same, and in some cases it is different. In case of tetanus infection, the source and reservoir both are same, that is the soil. Whereas in case of the hookworm infection, the source is the soil which is contaminated by the larva of hookworm, and whereas the reservoir is man. And sources are mainly of two types, endogenous and exogenous. So endogenous is with the term itself, endo, it is something inside, that is it is present inside the host body, that is the normal flora of body. Exogenous, it is an external source, and we have 5 sources: man, animal, insects, soil and water, and food. So moving to the first source, that is man. So man is often described himself as his own enemy, because most of the infections are transmitted from human sources, and human sources can be of two types: patients and carriers. So patients are those who suffer from the disease and they carry this pathogen, mainly for example pulmonary TB. So a person who is infected or who is having pulmonary TB, when he coughs or sneezes, the droplets are released into the air, and when it is inhaled by another person, it can lead to pulmonary TB in the second person. Carriers are those who harbor the pathogenic microorganism, but they do not show any signs and symptoms of the disease. So we have different types of carriers. So healthy carriers are those who have not suffered the disease, but they harbor the pathogen and do not show any signs and symptoms of the disease. Convalescent carriers are those who harbor the pathogen after recovering from the disease. And temporary carrier, they carry this microorganism or the pathogen for a short period of time, that is less than 6 months. Whereas the chronic carrier, they harbor the pathogen for several years. For example, a very well-known example is of typhoid Mary. Contact carrier is a carrier who acquires the infection from a patient, and a paradoxical carrier who acquires infection from another carrier. Animals maintain the parasite and they act as a reservoir of human infection, most of the human infections, and they are called as reservoir host. The infections transmitted from animals to man are called as zoonotic infections. Example, rabies from dogs. Rabies is an infection of the central nervous system, and it is transmitted by the bite of a rabid animal. And in India, it's most commonly by the rabid dog. Plague from rats. Plague is caused by the bacteria Yersinia pestis, and it is transmitted through rodents. Brucellosis from cattle. The causative organism is Brucella, and it can be transmitted by maybe consumption of raw milk or infected meat, as well as inhalation of the dust in the infected cowshed. Insects. Diseases transmitted by the blood-sucking insects are called as arthropod-borne diseases, and the insects which transmit these infections are called as vectors. So we have the examples like mosquitoes, ticks, mites, flies, fleas, etc. The next source is soil and water. So most pathogens, they survive in the soil for a very long period of time. Mainly we have the spores of tetanus bacilli, which is present in the soil for a very long period, and it can gain entry into the skin when there is an abrasion. Other examples are spores of Histoplasma capsulatum and eggs of roundworm. And water also serves as a source of infection in case of cholera. The next source is food. So here the food materials which are contaminated by the pathogen, they also act as a source of infection. For example, food poisoning by Staphylococcus, that is when the food is contaminated with the toxins produced by Staphylococcus and it is consumed, it can lead to food poisoning. As well as Salmonella, when you consume raw or undercooked meat, egg or egg products which is infected with Salmonella, it can lead to food poisoning. Moving to the modes of spread of infection, how the infection will spread. So there are different types based on contact, inhalation, ingestion, inoculation, insects, vertical transmission and vectors. So the first one, contact. Direct, and there are two ways, direct and indirect contact. So direct contact is through when you are come in contact with the skin and mucosa of the infected person. So mainly sexually transmitted diseases like syphilis or gonorrhea are transmitted. Indirect contact is through the agency of contaminated fomites. Now here fomites refer to the inanimate objects. They act as a vehicle to carry the pathogen from one place to another. For example, clothing, pencils, toys and bath towels. Inhalation, inhalation, there are respiratory infections like pulmonary tuberculosis, influenza are transmitted by inhalation. So usually what happens is the nose or throat secretions, they fall to the ground and they will dry up. But certain bacteria like tubercle bacilli, they are resistant to heat and dryness. So they will remain viable in the dust and they can act as a source of infection for another person. Ingestion, so most of the alimentary tract infections, they are acquired by the ingestion of food and drinks which is contaminated by the pathogen. For example, cholera, the causative organism is Vibrio cholerae. Dysentery, it can be amoebic dysentery as well as bacillary dysentery and food poisoning. Inoculation, so pathogens may be inoculated directly or through the iatrogenic mode. So directly it can be inoculated into the skin or tissues of the host, for example rabies and tetanus spores. Rabies virus, as I told earlier, by the bite of the infected or by the bite of the rabid animal, and tetanus spores, they are inoculated directly into the tissues through the abrasions in the skin. Inoculation may be iatrogenic through unsterile syringes and surgical instruments during procedures like catheterization, lumbar puncture, dialysis, etc. Example is serum hepatitis caused by hepatitis B virus. Vertical transmission, there are two types, transplacental and transmission through the birth canal. Transplacental transmission is an infection which occurs through the placental barrier and it could lead to abortion, stillbirth or miscarriage. And transmission through the birth canal, it does not cause any congenital malformation, but it can lead to infections caused by Group B streptococcus and Neisseria gonorrhoeae. And moving to the last mode of transmission is the vector. So we have two types of vectors, mechanical vector and biological vectors. Mechanical vectors are those who transmit the disease mechanically. The life cycle does not take place in them. They just help in transmitting the pathogen from one place to another. That is dysentery bacilli, which is transmitted by the houseflies. Biological vectors, here a part of the developmental cycle of the pathogen, undergoes inside the body of the vector. For example, the Plasmodium parasite, it has two life cycles or phases, that is the sexual phase and the asexual phase. The sexual phase takes place in the Anopheles mosquito in case of malaria. So moving to the summary, microorganisms are capable of producing disease in the host and they are called as a pathogen. The lodgement and multiplication of parasite in the body is known as infection. Nosocomial infections are cross infections occurring in the hospitals. Sources of infections are man, animals, soil, water, food and insects. So here are the references. Thank you.